As a dentist, we often encounter a patient with chief complaint of difficulty in chewing food or even difficulty in speaking due to overgrowth of bone on buccal side of maxilla or lingual side of mandible, also known as tori, right? Hi, I am Dr. Patsha, dental surgeon practicing since 12 years. Welcomes you to our channel where every week I am going to discuss tips and tricks about dentistry. So if you have not subscribed till now, do subscribe it.
So as you see, there is bony protuberance in 2 to 3 region, and due to this protuberance, patient is having difficulty in chewing hard foods. So today we are going to do alveoplasty procedure. As this is aesthetic zone, I will not make vertical incision in front. I will make one incision distal to canine, and that to papillary preservation incision. I am preserving papilla. It is a firm bony incision, as I am going to reflect full flap including periosteum. So first vertical incision and then circular incision. Make sure there is no tearing of gum, because this is aesthetic area. We don't want any tear or recession or scar. So slowly circular incision, as you see, one tooth distal and one tooth mesial, and then we will reflect. I will reflect this flap slowly with the help of periosteal elevator. You can use any periosteal elevator which you are comfortable with, but make sure there must be no tear in that region, particularly the gum area above that bony protuberance is very thin. So many doctors got tear from that area. So make sure there must be no tear. You can put finger over there and slowly reflect above protuberance area. Once it is reflected, then the procedure will be very easy. So you need to take care for proper incision and reflection. You can use gauze piece to rub in that area to get a proper vision, but our main goal is to do neat and clean incision reflection. If you have good vision like this, you can easily do the procedure for any surgery. Main thing is to have a neat incision, good reflection and very good vision. So I am using gauze piece just to clean that area for better vision. So if you see, the bony protuberance is clearly seen in that region, in 2-2 and 2-3 regions, slightly in 2-1 region also. See. So with the help of large round burr, or you can have flame shaped burr also, but this burr need to be different from the one which you are using for denture trimming. Make sure you have two different burrs. You can't use the same burr which you are using to trim the denture over here. This burr need to be separate autoclaved burr. You can't use aerator for this procedure, as it may cause air emphysema. Simple straight handpiece, large round burr with continuous irrigation of normal saline or distilled water. you need to trim slowly and give the shape. All excess bone need to be removed. Check with the finger, is there any sharp bone is there or not. If yes, then again remove that thing. And the main part is that you don't need to trim so much that you expose the underlying root. So do the procedure very slowly, and you need to keep bone equal thickness all over there. Between two protuberance there will be ditch, so you don't need to touch the burr over there, and give shape slowly in such a way that it merge with the adjacent ditch area. Once you perform this procedure, see how slowly I am doing. So once trimming is over, just place the flap on the bone and see how beautiful it sits on the bone. Check if there any sharp bone is there or not with the finger, and if not, then it is done. Then we will then we have to start suturing. So here I have used 4-0 suture. If it is always better to use 4-0 or 5-0 suture in anterior region. This is silk suture, non-absorbable. I will cut this suture after 7 days. If your patient is going out of city and not going to come back, either you can use the same suture and tell your patient that you can go anywhere at that place and tell dentist to do suture removal, or you can use absorbable suture. But the only thing is absorbable suture will absorb after 28 to 30 days. So till that time patient need to maintain the area, because sometimes there will be food lodgement and stitch abscess is also possible. So better to take non-absorbable suture and do suture removal after 7 days and check the healing. So it is perfectly done. Flap is placed nicely. Here I have not taken suture on distal side as it is not needed. Otherwise, if it is very big flap is open, you can take suture over there also. See how beautiful it looks after the surgery is done, and I am sure patient will be happy after 7 days because its chief complaint was solved. So you can also do this surgery very easily. I am sure you like this video. So best of luck for your case.
I am sure you like this video. Do subscribe my channel. Share this video to as many dentist friends possible. This is Dr. Pasha. See you in next video. Bye bye.